Good evening and welcome to the rest of the news. Our special guest this evening is Teresa Frerking.
That's correct.
Now, Terry was born in Italy and near Naples, and had some experience with socialism in Italy and with socialized medicine. You were born in Italy and lived there till 5 years old, and your family moved to Freeport, Grand Bahama, and then to Boston around 1964. And you've been back and forth to Italy or talking with relatives in Italy and have gained some understanding about the Italian economy and their medical system and their government.
Very much so. Very much so. Thank you, Dr. Simon. I appreciate the opportunity to speak with you. And to the folks in America, we've come to an intersection in this country. I think my having been born and basically raised and still communicating with my relatives in Italy, I understand very much what socialism is because my relatives live it. I understand when they retire. I understand how the work ethic is. I understand about apathy and what government dependence does. And I understand, most importantly right now, how nationalized healthcare works, and it's not good. And it very much gives me pause and causes me, gets me very nervous to see what President Obama is doing to this country, both employment-wise and social medicine-wise, and just turning people into too much dependence on government.
Well, now you were telling me about your dad who is elderly and he wanted to go back to Italy.
Yes, what happened is, of course, we had immigrated to the United States and have lived here for just over 40 years, and my mom passed away about 4 years ago. We were in Kentucky at the time, and she always wanted to go back to the homeland. So we took her ashes there, my father and my sister and myself. We took her home. And my father, just previously to leaving, my father had requested his four daughters if he could stay in Italy instead of coming back to America. And we said, Dad, you do whatever you want to do. You're 82 years old. You have that right. You want to stay, you stay. So therefore, my sister and I came back to the United States, and we left my dad, and he stayed with relatives. And then he acquired an apartment. During that period of time, of course, as a daughter and father, you communicate via the phone. And I could see that he was getting very sickly in his voice. His voice seemed a lot weaker on the phone as the months went by. And I would call my relatives and say, is he doing all right? Well, he's 82 years old. Things like that happen. What had transpired, and I did not know about, is he landed up going into the hospital in Naples. And the story I got afterwards, through a conversation with my father on the phone, is he was put in a huge ward. Now, my father's been living here for 40 years. He's been in the hospital before. In fact, he did have recently, I think it was not a kidney, but an organ removed. And he's used to a semi-private room. So the idea of having to compete with all the other patients, all the older other patients.
About how many people do you think might have been in that?
It was a large room.
Maybe 20?
I have no idea. I never asked my dad, but he's not used to, and if you call the doctor, he doesn't come lickety-split. If you call the nurse, they don't come lickety-split. You're used to that in the United States. You push the button and the nurse eventually comes. Not in Italy. It's when it's your turn. Plus, he was not of the class, the rich and the rest, that had money to pay. He was on the nationalized health care, okay? That's how he operated. He was considered part of the nationalized health care. So that's what he stayed in the hospital, and then he was, of course, released. A few weeks later, he called again, and he sounded really, really ill. And that's when he placed a call to me, and he said, Terry, come get me. If you don't come get me now, I'm going to die here. I cannot see a doctor for 3 weeks, no matter what.
He couldn't get an appointment for 3 weeks.
No, he had to wait.
Even though it was an emergency.
Even though it was an emergency, he had to wait. And this is what we're facing now. This is going to happen here.
Yeah.
Okay? And what the system in Italy, how it operates, is there are the rich folks who can afford a doctor out of pocket.
And pay out of pocket.
That is right. And this is the same thing.
No insurance necessarily, just out of pocket.
Out of pocket. It's who you know, and if you have money.
Cash and carry.
Yes, that's right. You have money in hand, money talks. If you're on the public health system or the nationalized health care system, you have to compete with and wait like everyone else. And my father had to wait. So that's how it operates. This is how Medicaid is going to work eventually.
Here in
It's
America.
going to be the rich who can afford all their doctors and their concierge care, and everyone else will be put onto waiting and the massive ration health care. That'll be the rest of us. Exactly what is already operating in Italy right now. And they're finding themselves so overburdened right now as far as programs, government dependence, they have to dial it back. They have to dial back programs. And let me tell you another...
Now, what does that mean, dial back?
Dial back meaning
Reverse it.
Yes, because there's too much dependence on government and programs that they're having to cut the ties. You think about welfare. Eventually, we're going to have to tell people you have to get back to work, okay? The money runs out. And in Italy, we know the economy is not the best. They're not in the top 10, the top 20 nations in the world. They're not China. They're not Russia. They're one of the bottom rung, and they're having to dial back all that government dependence. Now, as far as employment goes, right now, all my relatives, first of all, they retire when they're 50.
When they're 50?
50 years old, that's right. Then you live on your pensione, on your pension and such. Now, who do you think is paying for those pensions? It would be the young kids, right? Right? All the kids. But then the young kids, the college to about 30 years old, there's unemployment for 25% between the ages of college and 30 years old. My cousins who are 20 up to 32 are still living with their parents because they can't afford to live
Well,
on
we're
their
getting
own.
some of that here in the United States already.
Of course we are. This is a way of life. Of course you live with your parents when you're 25 and 30 years old. No, you don't. I moved out when I was 21. Not in Italy. You can't afford. So you live with your parents until you are married. Then you might move out of your parents' house. You might, if you can afford to. Unemployment is high. I have one relative who couldn't stand to live in the unemployment. He's in the graphics field. This is other than ourselves, he is the first in our family that has left Naples, Italy to seek employment. He is now working in Ireland. He took his family to Ireland. So he is the second that has left Italy because of the unemployment and to seek a competitive edge and a better way of life, just like my father and mother did. Okay? I've got cousins that are asking if they can immigrate to Canada so they can have a job. I have offered that maybe we can help him come here, but I understand that our immigration system is quite hard to get people into this country.
from anywhere or from Italy or?
I don't know the immigration rules right now, but I understand they might be a lot stricter now than they were before. I don't know. Now, my father came here with a job. My relatives in Boston already found a job before we immigrated, and that's how we came to America. We came through the front door. We paid all the fees. We had our health checked to make sure we didn't have some kind of disease. And we came in the front door and we had to check in, I think it was every year, as an alien. They called us aliens then. And had to re-up every year and tell them where we were, what we were doing, were we still working, and such like that.
How long did that have to go on?
Oh, it went on. I was 13 when we immigrated. When I was 19, my sister and I figured that my parents weren't going to seek citizenship, and we knew that we wanted to make America our home. So we studied, and we took the citizenship test, and we became Americans when I was 19 years old together. And that was a very, very emotional and proud day, and I'll never forget it for the rest of my life.
Well, now we got all these people coming in from Mexico.
Right.
They don't do any of that.
No, they don't. They come in the back, they sneak through the back door and use, I guess, our need for businesses, and they do it illegally. And I have much to say about that, but that's not the point of this discussion. I think it's wrong. We have laws. We are supposed to be a nation of laws.
In other words, there were exams you had to take and understand our history and our language
Absolutely.
and all that.
Absolutely. In fact, I remember a time I was working for attorneys at the time, 2 judges in Boston, Massachusetts, and I was studying on my lunch hour. I was studying the test, and some of the questions I would ask, and the legal secretary would say, "Well, what's the answer to that? I don't know the answer to that." And I was just amazed that they didn't even know their own history.
But they were demanding that of you in
Correct.
order to become a citizen.
Well, yes, you have to study you have to study the Constitution, you have to study questions and answers, know certain things, understand government and how it works before you can take the citizenship test.
But all of these people that are coming across the border illegally, they go to the head of the line and become, they're trying to say, oh, these people are going to become citizens without any exam, without learning the language, without learning a history. Is that right?
That is right, and truly I believe that is very unfair to the folks who abide by the law and wait and are patient and follow the steps to come and immigrate to this country. Very unfair. So I don't believe it's right.
They go to the head of the line without doing any of the required studies or exams or learning the language or anything.
That's another thing about learning the language. When I was 5 years old, I spoke Italian, and I still speak Italian, by the way, because I converse with my relatives. The first thing we did is learn the proper English. We were taught by, I went to a parochial school, and we learned how to speak American English, and ever since then, I speak Italian, and I speak English as well. But our parents always preferred that all 4 of us speak English all the time.
They wanted you to learn the language.
Absolutely, and they did too. Both my parents had a tutor come in to teach them English. They insisted that we learned English well, and they insisted that we go to school, had good grades in school to avail ourselves of the best, because he wanted 4 girls to be independent on their own and not have to depend on anyone. That was the way that my parents raised us, to always depend on ourselves, not on government or anything. And by the way, when we immigrated to Boston, my father made a couple $100 a week for 6 people, okay? And we rented a little home in Woburn, Massachusetts. And one day my father comes home with some stamps. And my mother goes, "What are those?" And my father proceeded to explain what they were. They're something that you can use to buy food and things to help a family who doesn't have enough money. My mother told my father emphatically, "You take those stamps back to your office We do not want these things in our house. You take them back.
Really?
And my father still tells me the day, and I honor my mother and my father for never having depended on government ever. Yes, my father's on Social Security now. That's it. On Social Security, on Medicare. And in addition to Medicare, I advise my father to get his own additional, Medigap insurance.
A supplement.
A supplement,
Yeah.
yes. So he can always, and right now, he is living on his income, not on the government's. Yes, he has $1,000 a month. That's it. And he lives on his own income, and that's it, and his own savings. Not anything to do with government other than what? He has the $1,000.
Well, he put money into Social Security.
Yes, he did. However, life costs more than $1,000. So he still has saved along the way, so he is taking care of himself. And I honor him for his courage.
But I think you were saying that when he went to a socialized medicine program like we're getting into today here in America, that the hospital care was very inferior.
Yes.
And they put him in a huge room with lots of other people, and the nurses didn't come when they needed them. There was a long delay, and finally he got out of the hospital and tried to get a doctor, and there was 3 weeks delay in even getting a doctor.
Right.
What was it that triggered him to call you and say, "Come and get me"?
He knew the better life that he had experienced in America.
Like America before
You
they
want-
socialized medicine.
Of course, because you want a doctor, you see a doctor.
Right.
Okay, come in tomorrow if it's an emergency. Can you come in next week? He wasn't used to having to wait 3 weeks for something that he felt very, very ill. He knew he was feeling ill.
And it turns out he had pneumonia.
A double pneumonia.
Double pneumonia.
Yes, when he was sick on the airplane, very sickly, not moving well at all. My father is a spry man. He worked in construction for 30 years out in very, very hot tropical weather, sometimes 7 days a week to make money. Okay, so he is not a weakling. And when I saw him on the airplane, I did not see the same man. So I knew he was very sick. And upon landing, he landed up in ER with that double pneumonia in the hospital for a couple of weeks.
So they were going to make him wait 3 weeks, but as soon as he got into America under the free enterprise system, they put him immediately in the hospital.
Absolutely. Absolutely. And
So that tells you what we got to look forward to under Obamacare.
It's going to happen with the amount of people that are thrown into the system right now. It's going to be ration care. The folks who, Hollywood actors, the folks who can't afford it will get their own doctors, but the rest of us will be thrown into the waiting status. It's whoever is kind of like an emergency room. Whoever is bleeding and is going to die in the next minute gets looked at, but everyone else waits. What about cancer? You know, all the cancer research that we're doing right now. I myself am a breast cancer survivor, okay? And I couldn't wait for an exam and take care of it. Now I'm six years free from cancer.
6 years.
Yes.
Boy, that's great.
So that's the thing. Am I going to get the same treatment? What if it comes back? My husband is a heart patient. 2 times open heart surgery. What about him? Care for him.
You know, Terry, we have a video that was filmed by a man who went up to Canada
Yes.
and interviewed people up there about their socialized medicine and how they had to wait. And he has a long list of people that died because they couldn't get into the doctor in Canada, couldn't get their x-rays or the MRI or the CAT scan. And we'd be glad to send that to our viewers today if they want to call and tell us they want the video on socialized medicine. The number is 893-2 2444. We'll send that to them today. And they can just call that if they can call right now. And if they don't get through, I mean, if there's nobody here, like they call at night or something, then they can leave a message on the answering machine. Just leave their name and address and things, and we'll get back with them. But you know, I've seen this video. It's very powerful, and there were a number of people that had died before they could get in to see the doctor. And that's, I guess, what we're going to have to look forward to here, too.
Unfortunately, Americans don't believe that it'll ever happen here. You know, they believe so much more of America. They have not seen what reality is in Canada or Italy or any other European country. They think it will never happen here.
Right.
They have this illusion that the government will take care of everything, just like it does for unemployment and welfare. You know, we've turned what did they say, a hammock into a comfy bed. And we keep doing that. And I do want to mention an apathetic story, the thing what apathy does. When I did go back and I saw my relatives, I came across my young cousins, the children of the cousins, and I was talking to them about, you know, traveling to they have condos or apartments. They don't have houses because of lack of space, I guess, in Naples. And I noticed all the garbage in the street, and I hate garbage and trash in the street. And I had turned around, and we had driven on the highway, and I said, you know, I noticed a pile of garbage on the highway. Is big old dump truck going to come and pick it up? Oh, no, that's just where everybody throws their garbage. And I'm like,
really?
What? You don't pick up your garbage? So I talked to them. I said, you know, in United States, we have volunteer programs where kids, people, organizations, 4-H clubs, Girl Scouts, they volunteer and they adopt a street or highway. And, you know, and they do it on their own, voluntarily, no money. And they do it because they care about their streets and their community.
Yeah.
And I said, why don't you go to your principal at your school and see if you can start, you know, just in your own little area and try to clean up your areas. And the 8-year-old and 12-year-old looked at me in amazement, and they said, are you pazza, which means, are you crazy? I'm not going to do something that the government already does. It breeds apathy. Somebody else will take care of it. It's not my problem. It's theirs. And that's what it breeds, apathy, dependence on government.
Now, Terry, you've rung a bell in my mind by what you're saying. You know, the United States has adopted an educational program called Common Core.
Yes.
And that's the federal government. And basically what they say is the children do not belong to the parents.
Really?
They belong to the state.
No, they don't.
But this is what the Common Core says, that your children belong to us. And we're going to teach them what we want them to believe, and you have no control over your own children, what they're going to learn. And, you know, America used to be the top nation in the world as far as our schools,
That's right.
our academic achievement in our schools. Now we're down to 25th, and we're falling every day because of, you know, kind of what you're talking about. The federal government has taken more and more out of the public schools, so the children are learning less and less, and they are, you know, somebody says they're teaching them the new morality.
Yes.
The new morality, which is the old immorality.
That's right.
And they, you know, they don't care about right and wrong, good and bad, what works and what doesn't work, freedom or dependency on the government. And the Ten Commandments and all of that went out the window when the federal government takes over. And so I think a lot of what you're talking about is the chickens coming home to roost when you say, oh, we're so smart, we don't need God anymore. We don't need right and wrong. We don't need freedom. We don't need the Constitution. We're going to get rid of all that because we're so smart. And now we're enduring the consequences of all that. Now, we got to, let me just say this. I'm sorry to interrupt you.
Sure, no.
We have a video on Common Core. In fact, we've got 2 of them. And we're going to send that again to anybody that calls us today, 893-2444. And call right this minute and leave your name. If there's nobody there to answer the phone, leave your name on the answer machine. We'll get that out to you today. All of this is free because we believe what you're saying. And we know it's a problem. And we're investing in our viewers because these people that are watching today are concerned too. And so call that number, 893-2444, and we'll get you both the video on socialized medicine and the video on Common Core.
Guess what else I saw in Italy while I was back 4 years ago? Going to the big churches, you know, the grandiose churches there. The kids don't go to school or don't go to church anymore. So the big, huge cathedrals are empty. You only find the older people going, the younger people. In fact, on Facebook, I was attacked by my own 22-year-old cousin saying, "Oh, you Christians, that's what you think about."
Wow.
I mean, this is my 22-year-old cousin, my cousin's child. That threw that back at me and said, so God is slowly being removed out of Europe. So this is where we're going. God is being replaced by government, and our children belong to the government. It's all happening.
I have to take, as a doctor, I have to take a course. I think it's 4 to 6 hours.
Yes.
On the drug problem. And they blame the drug problem on the doctors. But anyway, they don't have any idea what's causing the drug problem. You know, 50% of the teenagers have tried drugs, and that's part of the problem. Saying, "Oh, we don't need God; we'll just go to drugs instead."
Or government. That's
or
right.
Government, or both.
And all the immoral things.
We really appreciate you. I bet you have a lot more to say. Maybe we'll have to do it again sometime.
God only knows.
God bless you, and thank you very much for watching. And don't forget to tune in next week for the rest of the news.